Good morning, doctor. I really need your help. I have a final tomorrow, but I cannot study because I have severe pain in my jaw.
Hello, Mohammed. It's nice to see you again. Since you're a medical student, let me explain to you more about what the temporomandibular joint disorders are.
Wait a second, doctor. What is the temporomandibular joint?
The temporomandibular joint is a complex load-bearing bilateral synovial joint that is formed by the head of the condyle and the squamous part of the temporal bone. It controls the mandibular movements.
And what are the temporomandibular disorders?
TMD are a class of degenerative musculoskeletal conditions associated with morphological and functional deformities. They include abnormalities of the surrounding structure of the joint as well as dysfunction of the associated muscles. It is the second most common musculoskeletal condition and the most common cause of orofacial pain. Also, females are more susceptible than males.
What causes TMJ disorders?
It could be caused by unaware grinding of the teeth while under stress, which is the most common cause, autoimmune diseases, infections, injuries in the jaw area, prolonged dental procedures, insertion of a breathing tube before surgery.
What are the signs and symptoms of TMDs?
The signs and symptoms may include the following: a clicking sound upon opening and closing the mouth, which is the most common symptom, a chronic dull aching intermittent pain in the jaw, pain in the neck and shoulders, chronic headaches, especially in the morning, jaw muscle stiffness, locking of the jaw, and ear pain.
How do we diagnose it?
Initially, it can be discovered by self-diagnosis when experiencing one of the previously mentioned signs and symptoms, especially pain and clicking. If you experience persisting severe symptoms related to your TMJ, then it's advisable to consult your dentist for further diagnosis and evaluation. If the case needs more comprehensive treatment, the dentist will then refer you to a specialist or a maxillofacial surgeon.
How do we prevent TMD?
Well, try not to clench or grit your teeth when focusing or feeling stressed out. Try to chew on both sides of your mouth rather than just one. Avoid chewing gum for more than 20 minutes. Avoid wide opening of your mouth while yawning. When resting, the lips should be closed together and the teeth slightly apart.
What are the treatment options?
Non-drug therapies include mouth guards and physical therapy. Medications such as anti-inflammatories, antidepressants, and muscle relaxants. If all the previous treatments fail, surgical intervention might be necessary.